So, I popped into High House Insurance to see if they could quote for my house insurance rather than using the internet. High House got a great deal. So to celebrate, I bought a posh hairdo. It made me look beautiful, gorgeous enough to become a highly paid model. I then won Celebrity Big Brother. I had an affair with an MP. Now I'm promoting a doll of me that says, "Cool blimey, you're well fit."
Happy things happen when you talk face-to-face with High House Insurance. See if we can beat your home insurance quote from the internet. Find us on the High Street, Selsey, or call 606 552.
Hello, and a warm welcome to Manhood Internet Radio. I'm Tony Weiner, your host for the show. So, what can I tempt you with this week? Well, we start with a heartwarming interview with Tracy Gibbons and the marvellous work she's doing helping cancer patients. This is followed by 2 extracts from Selsey Life, our local printed magazine. Our local astronomer John informs us what we can see in the night sky, and we then have 3 recipes from Keith. We will finish the programme with a quiz, and I must say I found last week's a bit tricky, so hopefully it'll be a bit easier this week. Anyhow, let's start this week's show by handing over to Keith, who is talking to Tracy about her support work.
Hi, good morning, and in the studio with me now, I've got a young lady that I interviewed a few weeks ago about her Tai Chi Cha. Now, I've been practising that, trying to get it right for the past 3 hours. And she informed us all about Tai Chi Cha and what it was good for and what it did for you. And what she didn't tell me was the other things that she was involved in. She kept very quiet about those. But a little bird had a whisper in my ear and told me that Tracy Gibbons was involved in lots more activities, shall we say, and most of them involving people that are suffering with cancer or assisting with alternative therapies for cancer. And now, hopefully, she's going to tell us about some of those. Good morning, Tracy.
Good morning, Keith.
You kept very quiet. You were very secretive about this bit. But I believe you've been a volunteer at the Furness Centre at St Richard's Hospital for some time.
Yeah, I have, actually. And I didn't plan to do it, but a friend of my mum's was a volunteer, and she knew that I was a complementary therapist, and she had heard that they were looking for people for this new team that they were setting up at the Fernhurst Centre. So I just went along, and that's it. And probably about 4 years later, I'm still there, doing all the therapies that I do, which includes Tai Chi Cha, which you got right there. That was good. And so every so often we do a small class for cancer patients and carers, which is adapted slightly. So we run that every so often. And then also I do Reiki, and I use batch flower remedies. So that's for relaxation and emotional support.
Most of the things that you offer, which is massage, reflexology, aromatherapy, Indian head massage, I've come across all those. In actual fact, I've had most of those treatments at some time along the way.
Oh, that's good.
And I'm a great believer in things like massage and reflexology for relaxation, and Indian head massage. I notice a lot of hairdressers are actually starting to do that now.
Yeah, I think they are.
When they shampoo your hair and then they massage your head. But batch flower, never heard of. Could you enlighten us a little bit about that?
Yeah, it's batch flower remedies were devised by a doctor in the 30s, Dr. Edward Batch, and he came up with this system of 38 flower remedies, which he used to balance emotions, feelings, moods, personality traits. And basically, it's a very simple method of, it's a talking therapy, but with a bit of a twist. So people are talking about the story, what's going on. So, for instance, the cancer patients are talking about how they're getting on. But the thing that I'm interested in is how they're feeling, because obviously it's a very stressful time, difficult time for them. So what we do is we work together and we come up with a mixture of these remedies for things like... there is one for tiredness, so that's quite handy, because people with chemotherapy often feel very tired. But also things like shock, anxiety, all sorts of emotions. Basically, every emotion and feeling we cover. So then I make up an individual mixture of these, and it gently brings the feelings back into balance, so it supports people emotionally, because it's obviously quite a difficult time for them.
Oh, absolutely. It must be a horrendous time for some people to handle. Some people handle it differently. I lost a friend of mine recently who was unbelievable. He just carried on absolutely as normal. And when he passed away, his brother put a comment on Facebook as if he'd written it. And he was known as a bit of a joker. And he said, I've tried this and I've tried that. I don't know what to try next. I think I'll try a funeral. It was an amazing strength of mind to carry on and do something like that.
Yeah, I do meet some really interesting people, very courageous people, and they go through tough times. But it's nice to be able to offer something that can support them. You know, that and the Reiki, which is incredibly relaxing. So yeah, it's good.
Indeed. Now, I'm sure that in your practicing, as it were, you must come across other areas of help for cancer patients. I mean, I know if somebody goes to Macmillan, they'll point them in the right direction, but there are alternative therapists, if you like. There are different areas that they can go to. Cancer-wise, I believe, is another one that offers support.
Yes, yeah. Well, at the Fernhurst Centre, we do, as you said, the aromatherapy, massage, those kind of things. But also, we're lucky in this area because at Cancer-wise, which is near the bus station in Chichester, they have the therapies, but also they have support groups for people, so you can go along. And recently, I've done some talks for the young adults with cancer group, and we've got a session going where we did a sharing kind of thing with listening skills to help partners listen to each other about how they were feeling. And also last time we were talking about emotions and how you deal with difficult emotions, and we're due to do another one soon. So there are different things there. And also on the 12th of May at 10:30 they've got like a drop-in group, and I'm going to do one of my Tai Chi Cha demonstrations. So you never know, we might be able to start a group there as well, so that would be good.
Now, how many therapists do you have, or have you got that you work with? I mean, it seems to me that it's a big ground to cover, and perhaps not enough people. Do you have enough therapists?
Well, at the Fernhurst Centre, we've got 3 or 4 of us at the moment, but for various reasons, people have left recently, and it would be great if we could hear from local therapists, complementary therapists, who might be interested in giving just a little bit of their time to join us. The therapies that we cover, or that we're looking for massage therapists, aromatherapists, reflexology, Reiki, and probably Batch as well, because those are the things that are actually approved to be used. So we can't. Okay, it would be lovely to use other things, and I know people are very keen on other therapies and know that they help, but we have to go with what's approved by the NHS at the moment. So, but yeah, so if anybody is interested, they're hearing this and think they'd like to join us, and it's a really, really lovely thing to be able to do, and the patients are fantastic. So you could contact the Macmillan Information and Support Service in Chichester, and that's that's on 01243 831 727, and if you speak to Helen Fowler, she will give you some details, and hopefully you'll be able to come along and see what we do.
Good. Now, I believe there's also a gym instructor down at the Westgate Leisure Centre that's involved in it as well.
Well, Heidi does the works for the council, and there was an interesting article recently in the Initiatives magazine which caught my eye, and also I do know Heidi, and she does rehabilitation, and she's a gym instructor at the Westgate Centre in Chichester, and that she specialises in helping cancer patients. So I just think it's really good, because that's, you know, the holistic approach. You've got us with the therapies, you've got the talking therapies, but also, you know, people really do benefit from exercise and from, you know, the rehabilitation, various things to help maybe it's with their surgery, but I also think it's really good for people's self-esteem. If they're able to continue and exercise, then I think that's really good.
Absolutely. Well, I know it's slightly out of the Manhood, but only just. It's in Chichester, so it's not too far away.
No.
But there's also, I believe, a place called the Wessex Haven, which is over in Titchfield, near Fareham.
Yes, recently.
Which is open to people from this area, cancer sufferers from this area.
Yeah, definitely. Recently I've started teaching my Tai Chi Chair over there, and it's a charity that started in London, and they are setting up different centres around the country, and they've set up in Titchfield, which is near Fareham, because apparently there are about 1,000 people in the Hampshire and Sussex area with breast cancer. So they've decided that there's a need for a service in the area. So it's open to people in West Sussex and Hampshire, and you can have 10 free sessions with them, and they do different activities like yoga, Pilates and Tai Chi Chi, but also they offer counselling, therapy, different therapies, massage therapies, and also hypnotherapy. So if you're not too far away from there, or you fancy going over there, it's a really, really lovely place to go.
It's another therapy that I've used as well, hypnotherapy.
Oh yes, I think you said before. Yes, you do. Yeah, it's a lovely environment there. I mean, the thing at the hospital is obviously it's clinical, but they are. It's a clinical sort of environment. It's going back to the hospital. Although they try and do their best actually to make it a bit more patient friendly there. But actually, over at the Haven in Titchfield, it's just a really, really lovely place. It's beautifully decorated, renovated there. It's really nice. So,
well, that's fabulous. That's certainly plenty of information for cancer sufferers in the area that are looking to try out different therapies, alternative therapies, if you like, as alternative medicine, as it used to be called, seems to be becoming more and more accepted.
Yes,
by the establishment.
The thing with the services that we offer, we would say that they are complementary. So they're complementary to allopathic medicine and to the the treatments people are having.
Yes.
They're not an alternative. There are alternative therapies, but we run alongside the treatments that they're receiving, like chemo or surgery, that kind of thing. So yes, but those kind of those things are people just know that they're very supportive, and it's nice to have a relaxing, nice treatment, because people do go through quite gruelling bouts of chemo.
Chemo is not very pleasant at all.
No, and the radiotherapy. So it's really good.
Well, thanks for coming in, Tracy, and letting us into some of your secrets.
Oh, well, it's lovely to be here.
Some of the things that you do.
Okay.
And we look forward to seeing you in the not-too-distant future, when you might enlighten us with some more of your secret goings-on, as it were.
I'd love to come back. It's always nice to see you. Thank you, Keith.
Thank you very much, Tracy.
Thank you.
Thanks. Bye-bye now.
Bye.
Well, what a wonderful woman, and thanks must go to her and similar volunteers. So, moving on, and to a different theme, Joan Taylor reads 2 extracts from Selsey Life.
Max, a young Staffordshire Bull Terrier, initially presented to our clinics with intermittent vomiting, but responded well to symptomatic treatment. After a few episodes, Max was referred to our Emsworth branch for investigations into the underlying cause of his intermittent vomiting, including blood samples, X-rays and potential ultrasound scans and endoscopy. We were very surprised with the findings on his X-ray. A dessert spoon located in his stomach. Surgery was performed, but unfortunately the findings were worse than expected. The spoon handle had perforated the stomach, leading to leakage of stomach contents into his abdomen, damage to his spleen, and had created a large amount of reactive scar tissue to form close to his liver, kidney and vital blood vessels. After a lengthy surgery, the spoon was removed and the stomach repaired. He was kept in for a couple of days to monitor for any complications. Thankfully, Max made a full recovery. And now another story from the Cat and Rabbit Rescue Centre. One of my friends, Mouse, has found her forever home. She has been here at the centre for 9 whole months, and she was starting to think that she would never get a chance at a new home. You see, Mouse was a very lovely but nervous girl, and she wasn't really used to much interaction with people. Luckily for her, the most wonderful lady came to see her and instantly fell in love with her, and now she has gone to live in a nice, warm, new house. The Selsey Venture Club and Mr. Jeff Donnelly. When Selsey Venture Club was first established in December 1967, its founder, Mr. Cliff Rhodes, had already investigated its potential take-up by those it was designed to help. He put out feelers to find the right people to run the club through a management committee, and luckily found just the right mix of enthusiastic and willing helpers, all prepared, like him, to give a large proportion of their free time towards making the club a success. Amongst those first volunteers was Jeff Donnelly, the local Lloyds Bank manager, and he became the first and very long-serving treasurer. Through his skill in managing the club finances, the club was able to weather those early and rather precarious days when only one bus, a donation and quite old, provided the service over the years. Jeff's wise financial management enabled the club to buy a succession of brand new vehicles, some with tail lifts, so that eventually it had 4 in the fleet. The club, which was the first social service minibus group set up in England, will have been in existence for 50 years in December 2017. So it has proved to be a soundly managed organisation, largely due to the input of Jeff in its early life. We thank him and also the other founding members for their help and expertise at that time. The club simply wouldn't be where it is now without them.
Thank you, Joan. Those extracts were kindly provided by permission of Selsey Life. Now it's over to John to tell us what we can see in the night sky.
Hello, this is John Mallett with what to look out for in the night sky. If you managed to locate Gemini last month, then the next constellation should be easy to locate. This constellation is Auriga, on the right of Gemini in the west. It really looks like 6 stars in a hexagon, with the bright star Capella at the top right. Capella is 42 light years from us, so appears quite bright. But the other 5 stars range from 80 to 500 light years away, so appear much dimmer. The Milky Way, our galaxy seen edge on, goes through this constellation, but it's quite low on the western horizon at about 25 degrees, so it's very hard to see the Milky Way as it's dim. Again, in mid-May, Jupiter will be quite close to the Moon on the 15th and 16th in the southwest. If you look south, low down, at about midnight on the 21st, you may be able to spot Mars just below the Moon. Saturn will be very close to the Moon on the 22nd, so they're definitely worth looking for. On the 9th of May, the planet Mercury will pass in front of the Sun. This only happens about a dozen times a century, so it's quite a rare event. It'll start at about midday on the 9th until about 6 o'clock in the evening. However, a warning, you should never look directly at the Sun or through a telescope without a solar filter, as it will burn your eyes. It's also hard to see as Mercury is a very small planet and just appears as a dot on the face of the Sun. There will be many websites with images of this event, so just Google Transit of Mercury 2016. That's all for this month. Hope the skies stay clear for you.
Thank you, John. Now, Keith is resting his voice but didn't want you to go hungry, so he recorded 3 easy recipes to tide you over. And it's over to Keith.
Now, for those of you that are a little bit fed up with my chicken recipes over the past few weeks, we've got some minced beef pinwheels. Now, these are rather fun to make, and especially if you've got young kids, you can make these with them. And this is what we need. And these will make 12 minced beef pinwheels. So That'll keep you and the kids happy for an hour. And this is what we need. 1 tablespoonful of sunflower oil, half a medium onion, peeled and very finely chopped, 1 garlic clove, peeled and crushed, 500 grams of lean minced beef, 1 teaspoonful of dried mixed herbs, preferably freeze-dried, 1 tablespoonful of tomato puree, a tablespoonful of plain flour, plus a bit extra for rolling, a 500 gram block of ready-made puff pastry, 50 grams of mature cheddar cheese, finely grated. That's optional really, but it does give a little bit of extra taste to it. 1 medium egg beaten, some sea salt flakes and some freshly ground black pepper. And this is what we do. Preheat the oven to 200 degrees centigrade, or gas mark 6 in old money. Line a large baking tray or 2 smaller baking trays with baking parchment. Heat the oil in a small frying pan and gently fry the onion and garlic for 2 to 3 minutes until soft, and stir it regularly. Tip the mixture into a large heat-proof bowl and leave to cool for a few minutes. Add the minced beef, dried herbs, tomato puree and a tablespoonful of flour to the bowl with the onion and season well with salt and pepper, and mix with do that with your hands. Mix it thoroughly so it's all combined. Now roll out the pastry on a lightly floured surface into roughly 34 centimetres square. Spread the mince mixture over the pastry, leaving about 2 centimetre border around the edges. Sprinkle on the grated cheese if you're going to use it, and brush the pastry edges with a little of the beaten egg. Now roll up smoothly and firmly like a Swiss roll. And cut the roll into 12 slices using a serrated knife. The bread knife's ideal. Place the pinwheels on a baking tray or baking trays, depends which ones you've got. Space well apart to allow them to rise. Flatten slightly with the palm of your hand and brush the pastry sides with more beaten egg to give them a nice glazed look. And bake those for 15 minutes or until well risen and golden brown, and they're best served warm. And that's a very simple, very tasty little dish for you. And it's not chicken. Hi, and welcome once again to Keith's Kitchen. Well, we've got a couple of very simple recipes for you this week, but nonetheless tasty. And the first one is tortilla. Now, everybody said, well, tortilla, that's simple. Well, it is simple. But this will serve 6, and you can serve it as part of a tapas selection if you're feeling that way inclined and you want to impress your friends. And what we need is 2 tablespoonfuls of olive oil, 1 large onion sliced, vegetable oil for deep frying, 4 large potatoes cut into thin slices, 2 free-range eggs, and a half a tablespoonful of salt. Now, that seems an awful lot of salt to me, but there we go. And this is what we do. Heat the olive oil in a small frying pan and gently fry the onions until they're soft, but not too coloured. Then transfer the onions to a bowl, then discard as much of the oil as possible. Half fill a deep pan with vegetable oil and heat it to 170 degrees centigrade, or use a deep fat fryer if you've got one. And when the oil is hot, add the sliced potatoes and cook until a fork goes through them easily, but don't let them go crisp and brown. Now put the cooked potatoes in the bowl with the onions and set them to one side. Beat the eggs for a few minutes until well mixed, and then add the salt and beat again. Add the eggs to the potatoes and onions and gently mix with a fork to break up the potato slices. Using the frying pan that you cooked the onions in, pour in a potato mixture and flatten it down. Now leave to cook over a gentle heat for about 5 minutes, and once the tortilla is done, slide it onto a plate, cook side down, and take your pan, place it over the non-cooked side, then gently turn everything over so that the tortilla is back in the pan, cook side up. Place the pan back on the heat and cook as before, and when it's light brown underneath, take it off the heat and it's ready to go. Tortilla's nice when it's warm, but it really is best served cold. So that's a simple one for you, tortilla. And our next recipe from Keith's Kitchen is spaghetti with parsley chicken. Now you might be noticing that I'm quite partial to chicken as opposed to red meat, but I am, and that's it. And these are just some of the things over the past few weeks that you can do with chicken, and it really does give you a wide choice. Right, spaghetti with parsley chicken. This will serve 4 people, and this is what we need. 1 tablespoonful of olive oil, thinly pared rind of 1 lemon cut into julienne strips, 1 teaspoonful of finely chopped fresh root ginger, 1 teaspoonful of sugar, some salt, 250 ml of chicken stock, 250 grams of dried spaghetti, 4 tablespoonsful of butter, 225 grams of skinless boneless chicken breasts diced, 1 red onion finely chopped, and the leaves from 2 bunches of flat leaf parsley. And this is what we do. Right, heat the olive oil in a heavy base saucepan, add the lemon rind and cook over a low heat, stirring frequently for 5 minutes. Then stir in the ginger and the sugar and season with salt and cook, stirring constantly for a further 2 minutes. Pour in the chicken stock and bring to the boil, then cook for 5 minutes or until the liquid is reduced by half. Meanwhile, bring a large heavy base saucepan of lightly salty water to the boil, add the pasta, return to the boil and cook for 8 to 10 minutes or until tender but still firm to the bite. And meanwhile, melt half the butter in a frying pan, add the chicken and onion and cook, stirring frequently for 5 minutes or until the chicken is light brown all over. Stir in the lemon and ginger mixture and cook for 1 minute. And stir in the parsley leaves and cook, stirring constantly for a further 3 minutes. Drain the pasta, transfer to a warm serving dish, then add the remaining butter and toss well, and then add the chicken sauce, a toss again, and serve. Lovely spaghetti with parsley chicken. And that's it.
Excellent. Thank you, Keith. Before you head off to the kitchen, here's our quiz for you to puzzle over.
Right, hi, here's this week's Kevin's Connection quiz. 5 questions, something that connects all the answers. What is the connection? And question number 1, food question. Melton Mowbray in Leicestershire is famous for making which food? Question number 2, going back in time, which Hanna-Barbera cartoon was set in Hoagie's Alley? Question number 3, which Central American country is bordered by Costa Rica and Colombia? Question number 4, Americanisms. In America, on a car they call it the hood, but what do we call it? And question number 5, which cartoon strip written by Red Smythe appeared in the Daily Mirror between 1917 and 1998? That's it.
Thanks for that. The answers to the quizzes will be revealed by Keith when he takes over the chair again next week. That is the end of the show, so it only remains for me, Tony Weiner, to thank you for listening. Thanks, of course, to our production staff and contributors. And it's bye from me. Bye.